The White House has rolled out a new testing blueprint to help states reopen their economies, but some experts say even that isn't enough. I'm Trevor Shirley in Washington. I've got that story coming up.
I'm Raquel Martin in Washington. Lawmakers are calling on the Inspector General at the Department of Justice to investigate if federal prisons are doing their part to protect their prisoners and staff. I'll have more on that story coming up.
Consumer advocates say that some online sellers are hiking up their prices and playing on people's fears of the coronavirus. I'm Joe Khalil here in Washington. What lawmakers are doing to try to stop price gouging on a national scale.
Reports of PPE shortages at VA facilities bring up concern among lawmakers. I'm Basil Drum reporting in Washington what some senators want to hear from the VA.
Florida's governor visits the White House. I'm Kelly Meyer reporting from Washington what he had to share with the president about the state's response to the pandemic.
I'm Alexandra Limon in Washington with how the coronavirus pandemic is impacting DACA recipients and why they fear the worst is yet to come.
I'm Morgan Wright in Washington. Why New York Senator Kirsten Gillibrand is pushing to have universal paid leave included in the next coronavirus economic relief package.
The White House says its new testing blueprint will give states a safe path towards reopening their economies.
But we are going to make sure they have the supplies and the capability of at least testing 2% of their population every month.
Admiral Brett Giroir says that 2% goal will surpass the level of testing anywhere else in the world, including South Korea, a country widely praised for its successful testing program. And Giroir promises the states won't be left to fend for themselves.
The federal government is assuring that they have the supply chains, that the supplies are matched with what they need to do to test.
Giroir says states already have what they need.
It really is remarkable how we've gone from just a few tens of thousands of tests a little over a month ago to well over 5.5 million today.
We are still low in our testing capacity compared to where we should be.
But Chelsea Boyd, an epidemiologist and research fellow at the nonpartisan R Street Institute, says there's still much work to be done.
And a lot of the governors, when they speak, they're talking about how they're having a hard time procuring tests.
Giroir says the blueprint's state-by-state approach will allow the federal government to successfully ship testing resources where they're needed.
And I have every confidence that working together in the kind of partnership we envision, that the states will be able to obtain their goals.
Giroir says the White House plans to reevaluate the blueprint after May and June. Reporting in Washington, I'm Trevor Shirley.
$30 toilet paper, $70 hand sanitizer.
We see amazing markups of common items that many people need.
Some online sellers have been price gouging, trying to profit off Americans' coronavirus fears. Congressman Ted Lieu is one of a group of lawmakers who've introduced a bill to end price gouging during national emergencies.
Prior crises usually affected certain regions of the country. This is affecting all of America.
That it not only allows enforcement actions, but by having this in place, we will raise knowledge on the consumer side so that people know what their rights are.
Senator Kamala Harris says the law would prohibit businesses or private sellers from marking up items beyond 10% of their regular market price during any national emergency.
We will not only require enforcement by the FTC, but we will also give the enforcement ability to state AGs.
While the bill aims to prevent price gouging and punish those who do it, consumer advocates say it's a hard thing to police on a national scale.
The degree of fraud that I anticipate will be happening over the coming months is so great.
Ira Reingold is the director of the National Association of Consumer Advocates. He says laws may help, but the incentive to raise prices is still high.
Folks are going to take the risk of making huge profits and committing fraud as opposed to sort of the small chance that they'll actually get caught.
He says it'll take vigilant enforcement at the local, state, and national levels to stop the price gougers. In Washington, I'm Joe Khalil.
Florida Governor Ron DeSantis visited the White House Tuesday to share updates on the state's coronavirus response directly with the president.
Governor of Florida, Ron DeSantis, has done a spectacular job in Florida.
DeSantis was asked by reporters in the Oval Office why he closed the state later than others. DeSantis said his approach to addressing the outbreak was measured compared to other states.
The most draconian orders that have been issued in some of these states.
DeSantis touted the number of tests performed in the state and said the death rate,
fortunately, I think is much lower than most people would have predicted.
During the meeting with the president, DeSantis said available tests exceed the demand. But one lawmaker said it's still not enough.
Our local health experts are saying we've got to broaden the testing effort.
Florida Congresswoman Kathy Castor says testing is the most important step they can take as a state to get the economy open again. She says it's a choice that's not to be taken lightly.
When and how to open the economy is really a life or death decision.
Castor says as the governor looks towards reopening the state, he needs statewide feedback.
He needs to now build a bipartisan and community-wide effort so that everyone is part of this.
DeSantis has said he will update everyone on the future of Florida's reopening Wednesday. The state's current stay-at-home order is set to expire on Thursday. Reporting in Washington, I'm Kelly Meyer.
Terrence Hayes with the Veterans of Foreign Wars says reports about inadequate personal protective equipment inside VA hospitals is causing concern.
There's been, conflicting reports that at few of the facilities that unfortunately some of the staff members have had to share PPE or reuse it or even ration it out. And that's just unacceptable.
Now lawmakers are asking the Department of Veterans Affairs to find out what's behind those reports.
We've heard from the workforce that they're concerned about their safety.
Virginia Senator Mark Warner says the VA hospitals are told to follow the CDC guidelines for reusing equipment. But Warner says the guidelines are rapidly changing and difficult to keep track of.
If you've got a workforce that feels unsafe, and at the same time you're saying you got plenty of PPE, why is there this disconnect?
The VA said they have enough protective equipment and they are monitoring the supply levels at every facility. They say thanks to their safe practices, the rate of infection at their facilities is less than 1%. Virginia Senator Tim Kaine says money was set aside for the VA to avoid any supply issues. Now he wants to see where the money is going.
Now give us a report, about how you're using it, but what is your experience in getting the personal protective equipment that our medical professionals need.
Warner and Kaine say they also want the VA to provide flexibility to workers by providing paid administrative leave if they must self-quarantine. Reporting in Washington, I'm Basil John.
There's been an abnormally high number of deaths.
Iowa Republican Senator Chuck Grassley says he's concerned for the health and safety of federal inmates and prison staff during the pandemic.
We don't know whether the proper protocol has been followed or not.
Grassley and Illinois Democratic Senator Dick Durbin want the Inspector General at the Department of Justice to investigate. They want to know if the Bureau of Prisons is following CDC guidelines to prevent the spread of the virus.
We want to make sure that we're doing everything we can to keep the prisoners safe.
Already, nearly 30 federal inmates have died from COVID-19, and the number testing positive has more than doubled just in the last week, from 497 cases to well over 1,000. The Bureau of Prisons says it has increased testing and is carefully monitoring the virus's spread at its 122 facilities. But Durbin says he fears the BOP is, quote, significantly underestimating the rate of infection.
This is a matter of human dignity. It's literally life and death.
Heather Rice-Minus with the Prison Fellowship says she hopes a Justice Department review will pressure the BOP to release nonviolent prisoners, especially those in quarantine, to home confinement.
This doesn't make sense because people are being housed together. If someone does have COVID-19, they're exposing the other prisoners.
Grassley says he and Durbin have not heard back from the DOJ, but are working to schedule a call with the Attorney General, Bill Barr, soon. In Washington, Raquel Martin.
New York Senator Kirsten Gillibrand says the country needs universal paid sick leave.
We're the only industrialized country in the world that doesn't have access to paid leave, and it really harms our economy, and it really harms our recovery from COVID.
Gillibrand says workers without time off hurts everyone.
We've seen these critical workers who are the lowest income workers. They're the ones who don't even have sick days, and it's shutting down our supply chain.
And Gillibrand says increasing access to benefits like extended family and medical leave will make a real difference in the employment crisis during this pandemic.
They would still be able to be employed, receiving their paycheck or up to 66% of their paycheck with a cap at $4,000 a month.
Only 19% of workers in this country had access to paid family and medical leaves.
Shilpa Phadke with the Center for American Progress says a change would give workers the security they need.
Make sure that if they're sick, they're not going to work, and that they have confidence that they'll still be getting a paycheck.
But expanding paid leave faces a roadblock in the Republican-controlled Senate.
I don't think we can move down a more liberal agenda and simply say we're going to require businesses to provide that type of sick leave in all cases.
South Dakota Senator Mike Round says requiring those benefits would harm businesses.
You add a cost to a business and they may very well not be able to employ someone.
Reporting in Washington, I'm Morgan Wright.
Jonathan Rodas is a DACA recipient on the front lines of the coronavirus pandemic.
I work in the operating rooms, so I see patients that come into the operating room with the virus.
DACA recipients like Rodas, who arrived in the U.S. illegally as children, are protected from deportation by the Deferred Action for Childhood Arrivals program, begun under the Obama administration. Many DACA recipients work in hospitals, grocery stores, and other essential services. But Nevada Congresswoman Dina Titus says DACA recipients who are students were excluded from accessing coronavirus-related financial aid.
We got a ruling from DeVos who said, no, they are not included. So that's something that we want to fix in the next bill.
For DACA recipients, the next blow could come from the U.S. Supreme Court, which is expected to issue its decision anytime on whether President Trump can end the DACA program.
That could mean deportation for these immigrants who are urging the High Court not to issue an opinion in the middle of a pandemic.
I will feel useless because I'm not going to be able to help anybody. And that's my passion, to help people.
But Republican South Dakota Senator Mike Rounds says the court should go ahead and issue its order.
Once the DACA decision has been reached, then you will see congressional action one way or another.
Senator Rounds says Congress needs to revamp all U.S. immigration law, including DACA. In Washington, Alexandra Limon.
COVID-19 has taken so many lives and in turn so many incredible life stories, perhaps none more so than 100-year-old Philip Kahn, a man whose remarkable life was bookended by 2 worldwide pandemics.
Every time he started talking about his life story, he always started off with talking about his twin brother Samuel, who died during the Spanish flu. He felt this void throughout his entire life, that he didn't have the opportunity to grow up with his twin brother.
Surviving the Spanish flu pandemic, Kahn went on to fight in World War II, earning 2 Bronze Stars and participating in the Battle of Iwo Jima. As a Local 3 electrician, he helped build the World Trade Center. Kahn was passionate about the history he witnessed.
And even up to the last few days he was alive, he was watching the 24-hour news cycle of constant COVID. And he and I would talk about it, and he would say to me, "Warren, my boy, the pandemic, the history is repeating itself. The pandemic is happening again."
When he fell ill, he was tested for COVID-19, but Kahn died before it was confirmed that 100 years after his twin brother was taken by the Spanish flu, he would also be taken by a pandemic sweeping the globe.
Well, we've been absolutely devastated the last couple of days since we've lost my grandpa Phil. I know when seeing all the attention that his story and these historical events has gotten in the last couple of days, I know he's smiling in heaven.
It's fitting for a man so dedicated to history that Khan's great-grandchildren spoke virtually at his memorial.
And I just want to tell him thank you for all he's done for us.
Another generation to pass on the history of a man who witnessed so much of it. David Martin, The Associated Press, New York.
As COVID has devastated so many of our communities and the poorest communities in the greater New York City area, we are prepared to care for those children who are going to be either made orphan by this pandemic because their parents are going to die and some have already passed away. There are cases where children test positive and are symptomatic, and keeping them at home or with their family would be a risk to the family. And in those cases, we have specialized beds that are available.
We have isolation, and what we do is we were able to isolate those children in individual rooms. And then we provide food and medicine directly to them, and we also make sure to include things that children needed, especially as they start to feel better or what have you. Then what we would do is make sure that they have some time outside, and with some social distancing, and as well as making sure that they have some kind of recreation once they start to feel better.
Life has changed since the pandemic started. Like, for instance, I usually go home every weekend, and then when there's no school, I usually stay home. Now it's just I'm almost stuck here, and then everybody's isolated.
To be honest, it's hard to social distance with 10 kids and approximately like 7 staff at a time, because everybody's so cooped up and then get hyper and start running around.
Go, keep going. Whoa, what was that, Big Mac?
How you doing, Leanne?
Fourth-year medical student. Please take a seat.
Okay.
This has been like a crash course in public health, right? So I think that was the most unexpected twist of everything.
1, 2, 3 on one nostril, 1, 2, 3 in the other. Yeah, it was kind of a no-brainer. A way to be useful and still get that clinical interaction with people. Yeah, when I was talking to my mom like a week after I started this, I'd let her know that I'd spent 4 days this week testing COVID patients. She was like, "What are they giving you to wear?" And I sent her a picture of me in the full garb, and she was like, okay, fine.
This is just an unbelievable experience for me. I'm going to be a better doctor just because of this experience.
L-E-O.
We were excited to reopen. We were excited, but also cautious. We want to do this, but we want to do it safely. And is it time to do this safely? And can we do it safely? We have one entrance into the store. We have 2 entrances out of the store. We either cross paths. We have people at both entrances and exits counting people, along with telling them kind of the rules and regulations of the store while we open, as well as handing out face masks if they require it or if they need it. We do require having a face mask to be in the store.
We want to do things safely. That's priority 1. So if that takes hiring more people to do that, we're willing to do that, absolutely. Most greenhouses in Michigan, April, May, and June is where you generate probably between 70 and 90% of your revenue. To say it's critical is an understatement. Without this time of year, it's not sustainable.
I'm a teacher here in Hoboken, actually, so this morning during our Zoom lesson, we all spoke about how excited we were to see this and something that brings us together as a class, even though we can't be together physically. So something we can talk about tomorrow, too. So.
It brings out the spirit of the country,
And to help all the healthcare workers, just give them something to think about everybody's thinking about them, and they're really appreciated.
Oh, say, can you see by the dawn's early light what so proudly we held at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there.